Hi everyone, Dr. Alex here. So as a premier Invisalign provider, we see tons of Invisalign cases here in the office. And we get a lot of the same types of questions. So we thought we'd put a video together to address some of those questions here today. Now, before we get to the top 5 questions that we hear, I want to introduce you to the Invisalign system. So some of you have seen people wearing Invisalign trays, and you can tell they're basically invisible. You have to really stare in someone's mouth to see that they're wearing anything. So the magic comes with these clear aligners. It's a flexible plastic that we replace every 2 weeks, and that gradually shifts teeth where we want them to go. Okay? Now, you don't have to come into the office every 2 weeks. I'll check out your progress every 3 months or so to make sure that we're on track. Okay? So, what kinds of cases do we treat with Invisalign? It's a phenomenal question. Really, it is limitless. We can treat crowding, spacing, deep bite, overbite, underbite. So all sorts of different, what we call malocclusions, can be treated predictably with Invisalign. All right? Now, one of the key differences between Invisalign and some of the DIY ortho alternatives out there are what we call attachments. Attachments are these little composite or filling material, almost like little buttons that will go on teeth. And those serve as handles to move teeth and rotate them and accomplish movements that if we didn't have those handles would be almost impossible to achieve. Okay? So let's get into the 5 questions here. So number 1, how long does it take? Great question. Now, every case is a little bit different. The average Invisalign treatment takes around 10 months. And now what I can tell you is, what we accomplish in about 2 years with braces, we accomplish in 9 months with Invisalign. And that's because there's no wasted movement with Invisalign. When you put a wire on your arch, on your teeth, that wire is expanding everything at the same time, right? With Invisalign, we're moving teeth individually. So teeth that don't have to move, we're not wasting time moving them around. All right, so that's a key difference here. So question number 2 is, does it hurt? Now, I never lie to my patients. It's gonna feel tight. But tightness is progress, right? We're looking to move teeth through the jawbone. And the way we accomplish that is with sustained pressure, okay? Now, it is nothing compared to braces when you have those wires tightened or those bands adjusted where everything is hurting. Because remember, Invisalign is moving teeth individually. So if you go from tray 3 to 4, you may notice that the pressure point may shift from the left to the right side, or vice versa, right? You're gonna feel some tightness the first day when you go into your new trays, but again, that's a good thing. That means we're getting closer to your dream smile, right? So question number 3, how long do I have to wear them? Now, the beauty of Invisalign is that you get to take them out and eat and brush, right? You don't have to worry about food getting stuck in your braces or anything like that. Now, the number 1 drawback of Invisalign is that you can take them out. You gotta put them back in. The goal is to wear these trays 22 hours a day. So they'll come out for you to eat, brush, and floss, and then you snap them right back in. If we don't, it's gonna compromise our progress, right? And we're after that dream smile. So let's stick to the 22 hours, shall we? Question number 4, how much does it cost? Now, we offer here at the office different tiers of pricing depending on the complexity of your case. The average case can be done for a couple of $100 a month, and we offer great financing options for all of those tiers. Number 5, retainers. Great question. I always get asked, Doc, do I have to wear my retainers? Yes. Whether you straighten your smile with braces or with Invisalign, retainers are a must. Because guess what? Your teeth have memories and longings to go back home where they came from. And if we don't wear retainers, they will eventually drift back where we brought them from, okay? So I recommend that my patients wear retainers every single night. And one thing that I have noticed is that Invisalign patients tend to be far more compliant with their retainers than braces patients, because you're already used to wearing basically something that looks like a retainer. So when you transition from your active trays to your retention trays, it's going to be a snap. Pun fully intended. So we are offering complimentary consultations here at the office. If you are interested in Invisalign, we'll get you in, we'll take a 3D scan of your mouth, and we'll actually be able to show you right then and there what the projected outcome of your smile transformation is. So give us a call or email us. All the information is below, and keep smiling. It looks good on you.